First, I congratulate them. I mean, that is an amazing feat to kind of get control of your life back, whether that's diet and exercise or whether you had some help with bariatric surgery. The hard part's over. The fun part is getting to come to a plastic surgeon and make yourself feel whole again. When you inflate, then deflate that skin, you've stretched it to the point of no return sometimes. And once you lose all that weight, you have a skin suit. The skin, when it overhangs, can cause rashes, discomfort. It's hard to kind of roll that all up and throw it into clothes. As you can imagine, massive weight loss doesn't affect just one part of your body. It kind of affects everything. I like to only do a certain amount at a certain time, and as far as time under anesthesia, and competing variables. So I don't necessarily want to do a tummy tuck at the same time I do arms and inner thigh lift, for example, because I want you to have an extremity free to take care of things you need to take care of. Almost always the first thing patients complain of is their trunk, so their belly. That's what they look down and that's what they see, and that's usually the most symptomatic. So usually the first surgery is almost always the tummy, doing what we call either an extended abdominoplasty or going all the way around as a 360 lower body lift or belt lipectomy. That'll take care of your tummy skin, it'll take care of your flank skin, and then it'll take care of your back skin at the same time and kind of give you an outer thigh and booty lift. And so all those things, almost like a 360 you can imagine, is usually the first stage. In women, oftentimes it's breasts as well. So it's lifting up those breasts, maybe even extending it to get that upper back roll. And after that, we talk about arms, we talk about inner thighs, and necks. Lots of times there's a neck lift or facelift associated with these, even in young patients, because they age at a much more rapid rate once they lose that weight. I want you to be 6 months stable weight before even considering any procedures, and I like 6 months between each procedure. That gives your body enough time to heal. Nutritional consults after surgeries, whether it's massive weight loss or just diet and exercise patients wanting to get recovered, is really important. I mean, this is a huge investment in not only your time, but finances, and so you want to maintain this. And so I think having a nutritionist on board is fabulous. It's a neat thing. It's one of the most rewarding surgeries that I do, is actually doing some body contouring after massive weight loss.